So today we're going to talk about wildcards, and these are patients that present that could potentially have something really bad going on, but may not present the same way as what you'll read in your textbooks. So everything in medicine is a numbers game. You're always trying to figure out how likely is it that my patient has what I think they have. Is it 10% likely, 70% likely, 100% likely? And based on that likelihood, you then figure out what tests you need to order to either confirm or disprove your theory as to what's going on. So if we look at our standard bell curve, for patients that have high mortality diagnoses like potentially subarachnoid hemorrhage or unstable angina, we're allowed to miss no more than 2% of those patients. The problem is that with what we read in our textbooks and the classic presentations that we oftentimes hear about, it may only be as good as to get us only a 10% detection rate for these high mortality diagnoses. As a result, there's this population of outliers that fits between this 2 to 10% detection rate that we oftentimes are looking for and necessitate further testing and further investigation to make sure we're not missing something that could potentially be deadly. So like I said, everything in medicine is a numbers game. What you're oftentimes trying to figure out is, what is my threshold for ordering a test? When you identify these wildcard patients, your threshold will actually have to be brought down. That way you'll ensure that you're not missing a potentially dangerous diagnosis on a patient who may not present the classic way that you oftentimes read about in textbooks. And identifying these wildcard patients or these potential outliers is why these large retrospective studies are done, specifically looking at ensuring that you don't miss more than 2% of patients. Specific examples include the PERC score, which can be used to rule out PEs. So let's get into the list. The first group I always keep an eye on are the Superold. Now, I'm talking about patients that are over than 70 years old. These are patients that when they're septic may not mount a white count or a fever. They may even be hypothermic and have low white blood cell counts. When they complain of abdominal pain, they may not have the abdominal wall musculature to develop signs of peritonitis, like guarding and rigidity. As a result, the threshold to order a CT scan on these patients is much lower than you would for a normal, healthy 25-year-old who may come in with abdominal pain. The second group of patients I always look out for are immunosuppressed patients. Examples of these patients are chemo patients who may have gotten therapy 1 week ago and are potentially are at their nadir now, so as a result could be neutropenic. Patients that are on different room medications that suppress their immune system. Transplant patients. And finally, patients that have HIV or AIDS. The final group that I always think about are patients who may be anticoagulated. We're seeing a lot more patients on novel anticoagulants, and it's important to note when they are on them. This way, if you have a patient who is hypotensive, you'll know to look at their belly and ensure that they haven't had spontaneous intra-abdominal bleeding. Same thing goes for end-stage cirrhotics who may have no platelets. So hopefully this list will help you identify patients that may have a potentially life-threatening disease but may not present classically like what you read in your textbooks. When you present your patients to your attendings, you want to make sure that you emphasize these potential wildcard features. Oftentimes we start by talking about if the patient has hypertension or diabetes or hyperlipidemia, and these are all really important to note, but more importantly, if the patient is immunosuppressed or on anticoagulants, all of a sudden the game completely changes. And for your attending, it shows that you know what to look out for, because now the workup and the differential needs to be expanded to make sure that nothing life-threatening is missed. Keep a lookout through your training and see if you can add to this list of wildcards. Hopefully it will be something that you'll be able to use throughout your medical career. Thanks for watching.